All right. So the question is asking me, what concern do researchers have about earlier sleep studies? And based on this particular question, I think my answer is going to be here in this sentence, which talks about researchers worried. So that means that is another way of me saying they were concerned or they were worried. So researchers worried that these all-night studies, the studies which were done early on, did not replicate one of the major sleep habits of modern life. So basically, it means that these studies did not include or did not show us the same lifestyle or the same sleeping habits that the modern life entails or has. So in the sentence, I have my answer. Remember that here they have also used this particular term. They have used a colon here. And remember that whenever you're using a colon, the information that is going to be after the colon is always going to be about this part here. So here I have a colon. So because the colon is given here, that means the information that comes after, all of this information, all of this information is going to give me information about what is given before the colon. That is how colon works. If I have a colon here and here, so this information is going to be either an explanation or a reasoning or a detail of what was said early on. That means this information. So when I see here, they are also saying that getting some sleep each night, but not enough. So what they mean is that they did not incorporate or did not show us the major. They were worried they did not replicate one of the major sleep habits of modern life, which is that people get only some amount of sleep and not a lot of sleep. So that was something that they did not replicate. And because of that, I think my answer option C should be correct because option C is also using a term called mirror. Mirror is another term that is used for replicate or resemble. So that is saying the same thing. Remember that the rest of the information here in the form of a data is also providing us proof or evidence for the previous sentence. The same thing that this, according to this study, 30% of the US workers, they get fewer than 6 hours of sleep. That means they're getting some sleep, but they're not getting a lot of sleep. And this is far below than the 7 to 9 hours that most experts recommend based on the existing evidence. So this is the recommended sleep that we are saying that you should be getting, but you're not getting that and you're getting some amount of sleep. So the whole point of them using this data is so that they can support the previous sentence, which is the concern that the studies did not mirror current lifestyle habits regarding sleep. Now, some students might be wondering that, ma'am, I think answer option A or answer option B are better choices because our answer option, because answer options contain this sentence in the paragraph. Historically, most controlled sleep studies were short in duration. So they were short in duration, but that is not something that they are objecting to. They are questioning it or they're saying anything wrong about it, right? However, they are saying something, they are questioning something when they are using this term, saying, but extreme in deprivation. So this part is what that they are objecting to just a little bit, but extreme in sleep deprivation. This is written as a fact that most of the controlled sleep studies, they were very short in duration. Not very, in fact, they were short in duration, but they were extreme in deprivation. So the deprivation you had, the sleep deprivation you had, that was quite extreme. Once again, they are using a colon and they're explaining what they meant early on, that volunteers were kept awake for periods ranging from 24 hours to 5 days in a row, but they have not said anything wrong about it. Such acute sleep deprivation trials. Now, here, what they have done, look at this word. Here, they have used an adjective. And what is that adjective? Here, they have used the adjective acute. That is another synonym for the term extreme. When I use the term extreme or acute, I want to say that in terms of intensity, it is quite severe. It is quite severe actually. So extreme or acute, by calling it such acute sleep deprivation trials have shown or basically have shown The sleep loss alters several mediators of inflammation, metabolism, and other physiological pathways. However, what they have not said is that these results that we got, they are unreliable in any way. They are inaccurate in any way. They are wrong. They cannot be trusted. They've only commented on the extreme and acute sleep deprivation. And how do I know that they have commented on that? Well, I know that because they are using an adjective. Whenever the writer is using an adjective, that means the writer is expressing his own feelings or attitude regarding that. Correct? So, because of this, I know that the extreme sleep deprivation is something that the writer is agreeing with. Okay, but they have not talked about the results being inaccurate, and because of that, answer option A cannot be correct. Similarly, if I am saying that the results are not inaccurate, that means I'm saying that you cannot trust these results. And if you cannot trust these results, that means they are not reliable. But because inaccuracy part is wrong, this is also going to be wrong. They have used the existing data here in the end, but that they have used to support our answer option C rather than answer option B. Extreme sleep deprivation was something that they identified as a problem. However, they did not say that the results were inaccurate. Similarly, they did not say at all that the short intervals were a problem for them. So, this is actually not an issue for them. And the question asked me about what concern do researchers have. That means what they were worried about. So, based on that, our answer option C is going to be the right answer. So, in this question, they're asking us what does a molecular culprit mean exactly? They have identified this for us in the paragraph. And if we look at it, we'll understand from the word culprit only that culprit is someone or something that is responsible for something else, that is responsible for causing some sort of issue, some sort of problem, which is why we are calling this factor, this something or someone, culprit and not somebody who's responsible for something. So, culprit is used in a negative connotation basically. Culprit means that means there has been some issues. And what I see in this sentence only, I recognize that Van Cotter's team has identified a molecular culprit for what exactly? For this metabolic impairment. Now, if you have seen my previous videos, in those videos, we have talked about the term impairment, which is very commonly used in your OET reading whenever you're talking about your brain or some issues with the brain or the body. So, impairment means that the metabolism is not working perfectly. And when I say for this metabolic impairment, I mean in the previous sentence, when I'm reading this part about then discussing a drop in both blood glucose levels and insulin secretion levels. So we're finding a decrease or a drop in these. And for this, so this is definitely related to some sort of metabolic issue. And a factor which is actually responsible for this metabolic issue is what we are calling this molecular culprit. So we have used molecular culprit. That means it is some sort of molecule. It is not a gene, which is given in answer option B. Why is it not a gene? Because they have mentioned that they collected the abdominal fat cells from participants after 4.5 hours of sleep for 4 nights. And this, what did they focus on? Whether AKT. And what is AKT? It is a protein. It is not a gene. It is a protein, a key protein, a very, very important protein, actually, which is there in insulin signaling. It was active. So, this is a very important protein in insulin signaling. However, in the remaining part of the paragraph, I do not see anything that tells me that this particular key protein, this EKT, is actually reducing or is actually decreasing any kind of insulin signaling, which is given in my answer option C as an answer. So a substance is perfectly fine. Substance could be anything, a chemical, a protein, a bone, anything. But the substance is not really reducing the insulin signaling during sleep deprivation. So during the sleep deprivation, the insulin signaling is happening, but it is not being reduced by the protein. Similarly, a key factor responsible for sleep deprivation. Now, this would mean that this is a very important factor, which is actually a key factor or one of the major factors which is responsible for sleep deprivation. So that means it is because of this protein that the sleep deprivation is happening. Now, that does not make sense at all because, according to the paragraph, they're not at all claiming that this protein is the only main most important thing which is causing all of this. So, because of that, your answer option C should also be incorrect. And we are only left with answer option A, which says that a specific substance, a particular substance, which is involved in, that means which is responsible for the metabolic issues caused by sleep deprivation. So, due to sleep deprivation, these things happened. And during a sleep deprivation or due to sleep deprivation, so this particular molecular culprit is responsible for this metabolic impairment. This is why this is answer option A is going to be the correct answer here. Now, the question is asking me, what does Van Cotter regard as significant, something important, something worthy to discuss, or notable, something notable in her findings? And when I talk about findings, I know that there are two sentences in the entire paragraph which are discussing the findings. Uh, so there is one sentence here, and then there is another sentence that is being used here. Let's see, they found exactly what they found, that the AKT activities was much lower after this. What did it mean? They have used a hyphen to explain it to me, and that's about it. So it does not, I don't mean to say that these are the only sentences which are going to answer my question. What I mean to say is that these two sentences are the cores where this answer option is being discussed, and afterwards this like this question could be discussed in more detail with the help of examples, I don't know, but these two sentences are where they're actually beginning to talk about these two things. Because here, first of all, in this entire paragraph, they have only mentioned how the first people to conduct a control setting trial were these people, and that's about it. It's just their introduction. So none of this is helpful for me. Then they have given me the details of the trial, which I'm not actually answering a question on. What I'm interested in is the result of the trial, which is the finding, the outcome of the trial. Now, here they have mentioned that the researchers measured their blood glucose and insulin secretion. And what did they find? Finding that both dropped by about a third after sleep deprivation. So both of these dropped. Now, more recently, this person's Van Cotter's team, once again, they identified a molecular culprit for this. So earlier they found some sort of result. Then later on, what did they find? They basically found the reason behind that. That's what they did actually. They found a reason for this particular finding that they had gotten. And then afterwards, what did they do? Well, afterwards, they collected abdominal fat cells from these people. Once again, this is a detail. And again, after full sleep, they focused on whether the AKT protein in insulin signaling was active or not. And once again, this is a detail. But what is the outcome here? So the outcome was they found out that the AKT was much lower. This protein was much lower after the short sleep, after the restricted sleep, than after the full sleep. The reduce, and they're giving me more information about this. So hyphen is another thing that I use to give more information about this previous sentence here. The reduced AKT levels were similar to those. They resembled, they mirrored those which are found in people with insulin resistance, obesity, and type 2 diabetes. Now, I know one of my answer option A, is talking about metabolism resembling or similar to something or mirroring something like we saw early on, that of patients with terminal conditions. Now, I know that patients with conditions is correct, but I know that insulin resistance is not a terminal condition. Obesity is also not a terminal condition, and neither is type 2 diabetes. A terminal condition would be cancer on stage 4. So, terminal condition is where I have an issue, and because of this, my answer option A cannot be correct because they have not discussed any terminal condition in the entire paragraph. However, what I do see is that they have talked about this particular sentence here. Restricting sleep is equivalent to, is similar to. So, equivalent to is almost equal to, is almost similar to, basically. Similar to. What exactly? Well, it is equivalent to a change in your weight of about 10 kilograms, according to this person. So it is similar to that. But does it mean that it actually happened, that we actually gained or reduced any amount of weight if if we had restricted sleep? No, it does not mean that. It is just using it as an example to show like this is something as big as this. If I say that Amitabh Bachchan's height is as big as two Amir Khans stacked on top of each other, it does not actually mean that there is somebody or there is a person who has two Amir Khans stacked on top of each other. Like it's a very weird example, but this I'm making a comparison so that you can have a better understanding of this concept. That's exactly what they have also done in the paragraph. They have given us the example of a weight of about 10 kilograms so that we can understand how significant, how big of a change that is, how severe of a change that is. But there are two answer options which are actually talking about the weight gain or the weight change here. Answer option B and D. But in my answer option D, I see that the significant weight gain due to sleep deprivation. So this actually implies that there did happen a lot of weight gain because they've used the word significant due to sleep deprivation, but the weight gain actually never happened. And after like sleep deprivation of like or after any kind of study you cannot gain like 10 kg weight. That's just not possible. So the weight gain actually did not happen. This is just used as an example to understand a concept in detail, to understand the scale of that concept. So, based on this, metabolic effect was comparable to a notable, a significant. So, a change uh, in the weight of about 10 kgs, I would call it significant. And they have also called it, it is being used here to talk about this change that they have mentioned here, right? So, it is a big effect. So, they have used that this is a notable effect, this is a significant effect, or this is a significant finding, I would go ahead with. And so metabolic effect was comparable to a notable weight change. And if somebody is worried about metabolic effect, well, this AKT protein is actually responsible for the metabolic impairment. So the metabolic effect that they noticed in these people, because AKT levels are going to talk about the metabolic effect. So that they noticed in these people were was quite similar to the people who had these other serious conditions, but not terminal conditions. Basically, in other words, the restricting the sleep was quite equivalent to this much notable weight change. It was comparable, it was equivalent, it was similar, it could be compared to that, but it does not mean that it actually happened. So I like my answer option B and I would check answer option C also. The prolonged, first of all, they have not talked about an extended period of time, which is the meaning of prolonged in anywhere in the paragraph. They have not talked about it. Instability, they have not talked about any levels being stable or unstable of health with sleep deprivation. So C is not even discussed, and my answer option B is going to be the correct answer in this matter. Now, I like the questions which ask me about the writer's attitude or any other person's attitude. In this case, we want to know about how do the researchers feel about the effects of sleep restriction on health. Obviously, they're not going to be feeling great about it, but it does not mean that our answer option A cannot be correct because they're not talking about the effects here. They're talking about reversing the effects. But the problem with our answer option A is that it mentions something about reversing the effects, but the entire paragraph has nowhere actually discussed any kind of reversal of these effects that we have noticed on people's health once they have had restricted sleep. So, answer option A is definitely going to be wrong because of that reason. Now, coming back to the point why I love questions about attitude or questions about something that asks me to understand another person's perspective. I love those questions for one reason. The reason is very simple. If I am somebody who can understand or identify adjectives, adverbs, or vocabulary words meaning, then I would have no problem in answering this question because in order to identify how a person feels about something, I would need to see the adjectives which are being used by that person to talk about something. Similarly, the adverbs also are going to help me, and normal vocabulary words like nouns can also help me understand how the writer feels about a certain topic or how another person feels about a certain topic. Remember the choice of word here in terms of vocabulary. I can call somebody sincere and I can also call somebody uptight. While both of these people are following rules, but uptight has a negative connotation. That tells me that I don't feel positively about the person. So, using the same method, I am going to identify where exactly are they showing me any kind of worry, concern, confidence, or curiousness. If I see in this sentence, this part here, experimental sleep is also uncovering. So they are uncovering, they are revealing problems unconnected to metabolism. So far we had seen problems related to metabolism, but now we are not saying we are saying far more than that. And then they have started talking about the study. Remember, they mentioned something in general, an idea, and then they started talking about a study. Anytime they start talking about a study, a trial, any kind of numbers or statistics, they are trying to support the idea that they have mentioned here right before it, or that they are trying to introduce a new concept. But most of the time, they are trying to support the previous part here. And in this case, let's see if I'm right about this. Well, this particular study by these people, all of this is just introduction by them. It's unnecessary. It showed that sleeping for only 4 or 6 hours over 14 consecutive nights impairs, it weakens. See how the word impair is being used again and again? So it impairs, it weakens people's alertness and performance in several cognitive tests. Now, here, what I understand is that restricted sleep, actually is causing problems in people's alertness, and cognitive problems also are being caused, which is actually supporting the line that these are problems which are not connected to metabolism. These are problems which are connected to some other things. So, yes, the sleep restriction experimental that happened is covering more of these issues. It impairs these things. Now, coming back to the question, how do the researchers feel about effects of this? First of all, we have identified these effects, correct? Now, I want to identify how exactly the writer feels about them, or how exactly do the researchers, which are these people, by the way, they later found that limiting participants to sleep can affect the immune system too. So, it can affect the immune system also. That is another new thing that we got to find out from here. I'm just going to mark it. And then, towards the end of this experiment, sleep deprived individuals showed elevated blood levels of the immune signaling molecules, both of which have been linked to inflammatory problems such as coronary artery disease. Now, after reading this sentence, we identified some more problems. And these problems, both of these, have been linked to what exactly? Inflammatory problems such as coronary artery disease. So here, this person has not used an adjective or an adverb. Rather, what this person has used very, very cleverly, they have told us what exactly is happening. And by using an example of coronary artery disease, which is not considered something normal problem like flu or fever, instead they've highlighted that how these issues which have been highlighted here, elevated blood levels of the immune and the immune system being affected and impairing or making people's alertness and performance in cognitive tests very, very weak as problems, which could further be linked to some other issues as well, inflammatory problems. So it is causing quite, it is unconnected to metabolism, but it is causing far more problems. It is affecting far more things than necessary. So this is what I get to see in this. Now, they have not identified anything positive, anything like a solution or a treatment, and neither have they discussed any hopes of doing so so far. So they are definitely not optimistic about reversing the effects. They're concerned about its widespread impact. I would say they are concerned, and I would say that widespread impact. Why would I call it widespread? Because I have multiple areas which are being affected. One, two, three, four, and five. Widespread. So, yes, it is not just limited to one body area or one body organ. So, I would say definitely that it is a widespread impact. And because of that, I like answer option. But I'm going to see the other answer options also to check if they actually answer this question better than answer option B. Are they curious about something? If they had mentioned anything about doing more research or doing anything that helps them, that lets them find out more about this particular thing, then I would have probably gone with curious. Moreover, they're not curious about its impact on the body. The impact on the body is already happening, it's given in the question. What kind of impact? At least answer option B has commented on that, the widespread impact. But this answer option does not even comment on the kind of impact we have. So I would not like to go with C. They're confident it will not affect more than cognitive and inflammatory response, but it is already doing so. It is already affecting your immune system. There is your elevated body levels, blood levels as well. So it is definitely doing more than the cognitive. Not, it will not affect, that part is wrong, because it is already affecting more than the cognitive and inflammatory response. And they have not said any statement that would actually indicate that, yes, they are very hopeful, they are very confident that it will more likely or possibly not affect any more than what we have just discussed. So, based on that, answer option D is also going to be incorrect. And my answer option B is going to be the right answer. Now, in this question, they're asking me what aspect of his findings surprised this particular person. So, he found out some things, he conducted a trial, he found out some things, and there was something that surprised him in that. So, if it was surprising for him, it was something that he did not expect to happen. And because he did not expect it to happen, I would definitely not choose an answer option, which is discussing this part as expected, because as expected means that he was already hoping, he was already well aware that this would might probably should happen, any of those. So this says that the genes affected, the genes which were actually affected included those involved with stress responses, the immune system, and cellular metabolism. So this is something that he expected to happen. So according to this, if I look at the genes, limited sleep, basically the entire trial were talked about limited sleep. It affected genes related to stress and the immune system. But this is something that he already expected to happen. So that means this is not going to be the right answer, because these he already expected to happen. Now, What other thing that I find here is interesting is that he has used the term however. So that means he had expected this part, right? But something happened. So if he said as expected and then saying however, that means this is a part which he did not expect. However, it what it basically the sleep. However, it also affected several genes involved in overall gene regulation. So it affected several genes involved in overall gene regulation. It affected more genes, chromatin remodeling, suggesting that chronic sleep. So basically, what it suggested was it could lead to many more negative changes than researchers previously recognized or than researchers previously thought about or expected. What's more, so it is adding on to that point by using what's more, the number of genes. Again and again, we are talking about numbers. These they expected to happen already, the immune system, the cellular metabolism, the stress response. But it affected far more genes that they had imagined. Several genes involved in, and it involved genes which were doing some particular things here. It could lead to many more negative changes on the researchers, and the number of genes that responded to this jumped. That means they increased from 122 when the subjects were fully rested to 856. That is a significant increase after a week of restricted sleep. So I have two things. Number one, that the genes which were affected, those were very particular genes and they did not expect that to happen. So that relates to our overall gene regulation and chromatin remodeling. That the second thing I have is that they did not think that these many genes would be affected. Now, this is something that they're finding out about 856 genes are being affected. Did not expect that to happen. Another third thing, actually, additional thing that I'm finding out is that they're expecting that this now they are understanding that it could lead to more negative changes, which they had not anticipated, had not thought about. So there were changes in genes responsible for controlling other genes. But before this, I want to talk about my answer option C, because in my answer option C, there is this interesting thing, more and more genes. So when I see the term more and more genes, I am automatically thinking, maybe perhaps it could be the right answer, who knows? Because there are the terms more and more genes were involved despite sleep recovery. Now I have problem with this sentence, despite sleep recovery. They have not talked about sleep recovery. What they have mentioned is restricted sleep. So 122 was the number when the subjects were fully rested. That means they had less number of genes when they were completely rested, when the sleep had recovered. However, the number increased when there was restricted sleep. So during the restricted sleep, or as a result of the restricted sleep, they're getting 856. 856 genes which are being affected. So, and more genes were affected during sleep recovery, not despite sleep recovery. So, it's because of that, my answer option C is not correct. I like more and more genes, but answer option C is going to be incorrect because of this reason. Only first half of the sentence is actually somewhat correct and the remaining half is wrong. Remember to always check the meaning of the complete answer option and not just match the words with the words that you have seen in the paragraph. Now, if I look at answer option D, it says that sleep deprivation had negative effects on gene activity. Well, that was something that they already kind of had already expected. If you see this sentence, once again, the genes affected included those with this and this. So they were already expecting that number one, the genes would be affected, and they were already expecting that the effect is going to be negative because they were involved in stress responses, immune system, cellular metabolism. So far, we have read about metabolism and we know that it is a negative effect. So that means this is something that they did not find surprising. This is something that they were already expecting to happen. So answer option D is going to be incorrect based on that. Now I like answer option B more and more. Why? Because there were changes in genes which were responsible for controlling other genes. This seems a very, very simple answer option, but look at this sentence. However, it also affected several genes. It also affected several genes. What kind of genes? Which were responsible or involved in overall gene regulation. Overall. That means these genes were responsible for all the other gene regulations, making sure that all the other genes are working properly. So responsible for controlling other genes, which is why our answer option B should be the correct answer. Fairly easy question to answer this one. Why? Because I think I already answered this one while I was discussing the previous one. So here they have mentioned it. What does it refer to? So I see that the it word is here, also affected several genes involved in this and this. We have read the sentence already. It cannot be cellular metabolism or the immune system, which are mentioned both here. Even though both cellular metabolism and the immune system are singular nouns, remember cellular metabolism did not affect several genes. Immune system also did not affect several genes, but rather, as expected of what? Um, well, this was an expected result of a week of insufficient sleep. So this is why answer option D should be the correct answer. If I go ahead with answer option B, it would mean that the number of genes affected also affected several genes involved in, like some genes affected some other genes, which is not the meaning that we were going with, which is why B is going to be incorrect. So remember, whenever you want to answer pronoun questions, there are two steps to it. Number one, you identify what possible singular or plural pronouns could actually, oh my goodness, singular or plural pronouns could actually be nouns, could actually be used in place of this particular pronoun that you have in your question. You identify those. For example, the immune system could be used, the cellular metabolism could be used, but there was no other singular noun here. And then in the previous sentence, there was a singular noun here, right? So first of all, you identify which could be possible answers. Then the second step is to replace these one by one in the place of your pronoun. You start putting in the term immune system here and see if that makes sense, both grammatically and contextually as well. So you also have to make sure that the answer you are selecting is also correct contextually. A lot of students would just check them in terms of grammar and be fine with it. But here, in terms of meaning, both immune system and cellular metabolism did not make sense. So I had to go with a week of insufficient sleep. A lot of the time, students feel that, ma'am, I thought pronoun questions were only supposed to be answered based on what was given in the previous sentence. So, for example, here in the previous sentence, you have cellular metabolism or immune system. So, my answer cannot come from the sentence before that previous sentence, that is this one. But let me tell you something. So, let's say that there are some sentences here. This is sentence number one, and then this is sentence number two. Okay. And then we are continuing, and you have sentence number three here, and then we are continuing, and you have sentence number four here, and so on. And then you have sentence number five here, and we continue once again, and then you have sentence number six here. Okay. Now let's assume I have a pronoun question in sentence number four. So for that, obviously, the ideal thing for me would be to look at sentence number three, definitely go to the previous part. But if the pronoun that I have is something related to, let's say that if what I'm looking for is a pronoun which is asking me what this pronoun it is being referred to. So then please try to understand that this part, if I have not mentioned here in sentence number three, here also I have used the pronoun it. then I would have to go further than my sentence, than my previous sentence, and go to sentence number two here. Maybe here I'm going to find the noun which the pronoun it is actually referring to. So it's very much possible that you may sometimes need to go from farther than your previous sentence, but it does not mean that it is always going to happen, that you always have to directly start with, the last two sentences. No, you start with the last one sentence and then you figure out if you need to go further than that. Okay, because sometimes even if the pronoun is something that I found here, okay, or the noun is something that I found already in my sentence number three, but the meaning of sentence number three I have not understood, and because of that I may make a mistake when I'm trying to do the second step, which is to check the meaning contextually by replacing the noun with the pronoun in the next sentence, right? So, in order to understand the meaning, because sometimes the sentences would start with this, literally with the word this. So, I would need to know what exactly are they saying when they are saying this. Otherwise, I would not understand the meaning, right? So, it is very much possible that you may need to go to the previous sentence or even further than that. Not always, though, sometimes it does happen. And sometimes you can find the answer to that in the sentence which is actually containing your pronoun as well. Once again, sometimes it can happen, not always, but yeah, I hope it helps. So this question is actually very easy for me to answer. They have asked me what is one key challenge. Sorry about this. What is one key challenge that they have encountered in drug treatments for people who are affected by lack of sleep? I right away know that my answer option D is going to be the wrong answer. Why? Because, first of all, they have talked about biomarkers. Yes, they have talked about it. Here, they are using a biomarker. They are saying that if we were able to use, see, the term here is if they were able to use a biomarker, use a biomarker. That means if I was saying, if I was able to use a Ferrari in my video, maybe I would get more views or something like that. But it does not mean that I have to develop a Ferrari. It might mean that I might have to borrow it from someone or something like that. But they're not saying that they need to develop it. So developing part is the problem here, and which is why I have answer option D as a wrong answer. Similarly, I also know that the answer option C is also going to be wrong. The reason for that is they have mentioned that finding drugs, obviously, drug treatments is what they have mentioned. And we have to figure out what is a problem, what is the main problem in this drug treatment. However, one thing that you are going to see here is that in answer option C, they have also mentioned finding drugs that can address all types of sleep disorders. So the problem with all types of sleep disorder is that they have not mentioned any kind of sleep disorder or different kinds of sleep disorder in the paragraph. And because of that reason, answer option C is going to be incorrect. Although they have mentioned anti-inflammatory agent and another medication, which is here, anti-inflammatory agent and this particular medication they have mentioned here, they have not shown us that choosing between these two particular medication types is the most important issue they have in the paragraph. So, choosing an anti inflammatory agent or another medication, I would not go with this. But there are a lot of students who might go with this because they are seeing it in the last answer option. Please understand that they are using a quote, and I have always told you that whenever you see a quote being used, that means they are trying to support a point or disprove a point. And here they are trying to support this previous part that they have mentioned here. And what is this previous part? Well, simple. People whose lack of sleep could be damaging their health. So these people could benefit from drug treatments, right? So this is a good thing that they could benefit from these drug treatments. Although, but there is a problem. Although finding out which drugs will help which people is a challenge. So this is somewhat of a challenge for them. So this is a main problem that they have identified. And then they have used the code. So the code is definitely going to support this information, or it is going to add more information to the previous point. So that means if they were able to use a biomarker or a functional assay and identify or figure out which individuals who are not getting enough sleep, identify those individuals who are not getting enough sleep, figure out which people are not getting enough sleep, because it is specific to those who are lacking sleep, right? So figuring out those people who are not getting enough sleep and figuring out or finding out or identifying those people who are at a risk of adverse health outcomes, that could really help us give people feedback and perhaps target the mechanism pathways. Yes, that could definitely help us. Maybe they would be more likely to benefit from this and that. Correct. But here, what challenge they have identified, because they have not said anything negative here, really. They have not said anything negative. So the challenge that they have identified is this. Although figuring out this is a challenge. So they could not have made it easier. They're very, very easily identified that this is a challenge. So patient specific drug selection, which is another way of saying that choosing those drugs which will help a particular patient. So which drugs will help which people, patient specific drug selection for optimum effects, for the best effects, is a key challenge here. That is why this is going to be the right answer, because this is acting as supporting the previous statement rather than its own point. The challenge here is this. This is not a challenge. They have not used anything negative. They are saying maybe they would be more likely to benefit from this or this, but it is not specifically based on these. Choosing an anti inflammatory or this is not for all the drug treatments for people affected by lack of sleep, but rather these are patient specific drug selection. So there could be more drugs to choose from as well, which is why our answer option B is going to be the right answer. Now, biomarker is something that we used in the previous paragraph. Uh, Please understand that biomarker is supposed to be, for example, here, what did we use? A biomarker? Yeah, a biomarker. So biomarker is a biological marker. What do we mean by a biological marker? A measurable indicator of something that is used to assess the presence, do you have that disease or not, or the severity of a disease. If you already have a disease, then how severe it is. So this is the main point here, that it is used to identify the presence or the severity of a disease. And this is supposed to be a measurable indicator that you can easily use to identify these things. Then you had the term functional assay as well. For functional assay, it could be a test. Here it is an indicator, but here it could be a test or another experimental procedure, which is used to once again measure the activity or function of something. For example, you have liver function test, which check the function or how well the liver is working, the function of liver or how well it is working. Similarly, you have functional assay by the name functional. It is checking the activity or function of a specific biological component in your body. Then you have mechanistic pathways. So, biological processes or sequences of events that at the molecular or cellular level, basically, that lead to a specific outcome or effect. So, these are what we call mechanistic, because these are all sequences of events which are happening at cellular level or molecular level, and they lead to a certain event. I don't mean to say that functional assay or mechanistic pathways, these are some terms which are going to be used in your OET reading again and again. No. But I thought you might need this for understanding of the paragraph. Another thing, biomarker is something that will 100% be used in the later readings that you are going to read or do questions on. So please make sure you are aware of what is a marker or what is a biomarker, not a marker of different colors, but what is a biological marker, what is a physiological marker, what is a biomarker, a measurable indicator. Basically, this will 100% be used later. I love this question. I love this question for one and one reason alone, because of answer option B and because of answer option C. Well, let me explain in detail why I love this question and why you should too if you are somebody who appreciates little nuances in your sentences. So, my question asked me that why did the writer, or why, like basically for what reason, the quote from When Cotter is being used here? That was the question, correct? And we know that a quote is used to support a point or to, disprove a point. Okay, if that is true, then after reading this sentence, drugs of this sort, by this sort, I know what exactly? I know this kind of drugs. They will be more likely this and that, right? Drugs of these kinds of sort to could help to mitigate the consequences of sleeplessness or poor sleep quality. But now here's where we run into a problem. But they are unlikely. That means there are very less chances that they are going to be the perfect solution. And researchers are warning us about that they are not going to be the perfect solutions. But then when I read the code, I see that because of the multiplicity of pathways, basically because of this complexity of the issues that are related to sleep, I cannot imagine a single pharmacological approach, a single drug basically that will prevent the adverse effects of insufficient sleep, or basically that will be the perfect solution. So it is actually agreeing with what we said early on, that you're not going to find a perfect solution. You're not going to find one singular pharmacological approach. You're not going to have a magic pill that is automatically going to solve all the problems which are there due to the complexity, due to the multiplicity of pathways. Now, come back to our answer options one more time here. In my answer options, I want to first talk about answer option B, imply the lack of a perfect treatment. There is not going to be a perfect solution. There is lack of a perfect treatment, but here they have focused on how there is a lack of perfect treatment currently. At present, they don't have a perfect treatment. So does that mean that in the future there is even a slight hope that there could be a perfect solution, a perfect treatment? Well, not really, because here they are saying you're not going to have magic pill. That means in future also you're not going to have a magic pill. There is unlikely to be the perfect solution. That means it's very unlikely that this is going to become a reality, that this will ever become a reality, that you are going to have this. I cannot imagine a single pharmacological approach that will, not that does prevent, I'm not using present tense, I'm trying to say that will. I'm discussing things which are possible, which are not possible. It's unlikely. It's not going to happen. I cannot imagine this ever happen. So all of these three sentences are using sentence structures which indicate that I'm talking about something or I'm imagining something for the future. But answer option B talks about currently. It kind of emphasizes how currently there is a lack of a perfect treatment. So if I look at answer option C, and students are going to be confused in answer option B and C. They're going to be confused because answer option B and C talk about the same thing. But the only difference between answer option B and C is this, that answer option, I would say answer option B focuses on the current lack of treatment, but answer option C highlights the unrealistic. That means it will never become a reality. It is quite unrealistic for anyone to expect this. The unrealistic expectation of finding. That means they have not yet found it, and it is also impossible to find it because it is very unrealistic of finding a one size fits all solution. One size fits all is a collocation we use when we want to talk about one approach or one thing that can solve a lot of other things. Imagine having a master key. A master key is supposed to be a key that opens multiple doors, which is why you're calling it a master key, right? Now, here they are telling me that, this is quite unrealistic for you to even think you could find one. So that means currently we don't have it, and we are possibly not, probably, most likely not going to have it in the future also. So future, but without actually using the term future, they have talked about that in answer option C, and they have talked about only the present in answer option B, and which is why answer option B would be incorrect for this question to be the right answer. Now, once again, the same kind of problem I am seeing in my answer option D when they say that indicate that current treatments, it's not current treatments for sleep loss are ineffective. They have not said anything about the current treatments. They have not said that the treatments that we are using, they're effective, they're ineffective, we need to find better, no, nothing like that. They just cannot imagine a single pharmacological approach, or you're never going to have a magic pill. It's unlikely, there are unlikely to be the perfect solution because of the multiplicity of pathways. So this is why D is wrong. This is why B is also wrong. And some student might even think answer option B, that's possible because answer option B is using unconventional solutions. Unconventional maybe could talk about the magic pill that they have used here. But by magic pill, they are not trying to say that you need to actually use magic to find this tablet, to find this pill, but rather we use the term magic pill when we want to, in science, we use this when we want to talk about some things which are very unrealistic, which are impossible to happen. Or magic pill is also used to indicate how this would be the perfect solution for something, however, that does not exist or will not exist. So this is why your answer option C is going to be the right answer. Now, we also use the term mitigate in the previous paragraph. Mitigate actually means to reduce something, reduce the severity or the impact of something, which is why they had used that will prevent the adverse effects. They're not going to solve the adverse effects, but they're going to prevent the adverse effects, which is why it makes perfect sense because the effects are, in other terms, the impact of insufficient sleep or the consequences of insufficient sleep or sleeplessness or poor sleep quality. And we want to mitigate these, we want to reduce these, we want to prevent these, but we cannot solve these completely. Sometimes students think that mitigating actually means solving something. It does not. It means to reduce the severity or impact of something. Multiplicity of pathways means, that means obviously because of the word multiplicity, there is the word multiple, but that means there exist multiple biological or chemical routes. Pathways are always going to be this term. Pathways always is going to mean biological or chemical routes. Roots, pathways, footpath, pathways, right? Through which a process or effect can occur. So that means here the main point was multiplicity, and which is why multiplicity of pathways. You could have physiological pathways, You could be talking about effects, physiological effects on the body through biological or chemical routes as well. Then you have pharmacological approach. This comes very often in your OET reading, so please make sure you remember it. Pharmacological is related to pharmacy, pharmacist, right? A method that uses drugs or medications. It does not talk about relaxation technique or therapy, physiotherapy, nothing like that. It is completely dependent on drugs or medications to treat or manage a condition. That is what we call a pharmacological approach. Just like you have different kinds of approaches, physiological approach or pharmacological approach here. So that's about it for today's video. I hope you found it helpful to understand how to answer PAT-C questions, how to eliminate your answer options, and how to make sure that you understand why your codes are being used, why the data is being used in a paragraph, and how you can identify the writer's attitude or another person's attitude towards something. Thank you for watching.